Good afternoon. My name is Samuel Gaber. I'm a senior environmental health specialist with Fairfax County Health Department. I work with our climate health team and with Resilient Fairfax with the Office of Environmental and Energy Coordination. Today, Fairfax County Health Department is privileged to be able to engage in a conversation with a local and national leader in climate change advocacy, resilience, and adaptation. Along with us today is Dr. Edward Maibach. Dr. Maibach is the director for the Center of Climate Change Communication at George Mason University. He also co-directs climate change in the American Mind polling program with Yale University, and is also a co-investigator of Climate Matters, a public resource that helps empower local TV newscasters to be climate educators. In 2020, Dr. Maibach was the recipient of the Beck Family Medal of Excellence for scholarship and research, and Thomson Reuters has identified him as one of the 10 most influential scientists in climate change today. Dr. Maibach, welcome, and thank you for joining us today.
Hey, Samuel, thanks for having me.
Thank you. So I'd like to first begin our discussion by understanding what is climate change and how it impacts our health.
So rather than get into a technical answer to that question, because we could go on all day about that, I'm going to tell you that there are 5 key truths about climate change that every American should understand, okay? Climate change is real. And climate change, to answer your question directly, is the fact that our planet is warming. And as a result of that warming, the climate is changing in other ways. Climate is essentially weather over a long period of time, multiple decades at a minimum. So as a result of the warming, the weather is changing, our weather patterns are changing. So the first thing we need to know is if that's really happening. Second thing everybody needs to know is it's human caused. It's human activities that are driving the climate change. It's absolutely true that the climate has changed in the past. It's never changed as rapidly as it is currently changing, and human activity is entirely driving the current change in our climate. The third thing that people need to understand is that you may have heard there's some disagreement among the experts about human-caused climate change. It's just not so. Based on the evidence, more than probably 99.9% of the world's climate experts are convinced, based on data, that human-caused climate change is happening. There's no uncertainty there. The fourth important fact is what we're here talking about today, the fact that it's harmful. Climate change is harming our health. It's harming our environment. It's harming our natural resources. But I think the point of our joint concern is it's harming our health already in Fairfax County today. And the fifth and final thing that it's important to understand is there's hope. There are actions that we can take that will make a difference in protecting our health, protecting our environment, protecting our loved ones.
Now, is it just our physical health that it's impacting, or can it also impact our mental health and well-being as well?
So actually, I have some. I've got a little, let's see if I can get it in the screen here. I've got a report that's put out by the Medical Society Consortium on Climate and Health. That's a program that we run out of our center at George Mason University. I'll say the name again, the Medical Society Consortium on Climate and Health. People might want to Google that. And this report, called the Medical Alert Report, explains in simple, plain English the 8 different pathways by which climate change harms human health, okay? And one of those pathways is, in fact, mental health. Climate change, there are a lot of Americans out there who are deeply anxious, worried, and even depressed about the prospects of leaving behind a world to our children and our grandchildren that is less habitable, less hospitable than the world that we grew up in. And that we haven't published this yet, but we're doing research now and showing that between 10 and 20% of the population has anxiety and depression of potentially clinical levels of significance as a result of their concerns about climate change. So the answer is yes, climate change is deeply harming our mental health and well-being. But then the other 7 pathways by which climate change is harming our health, I'll just tick them off very quickly. Extreme heat events, heat kills, unfortunately. The heat also tends to make air pollution worse, so we're more likely to get orange and red air quality days as a result. Our weather, our storms are becoming more dangerous. Heavy downpours, big winds, dangerous weather. People get hurt. People get killed in dangerous weather. We're having more what they call vector-borne diseases carried by ticks and insects and rodents as a result of the changes in our ecosystems driven by climate change. We're having more water-borne illness and more food-borne illness. Our food is becoming less nutritious. And I think that might have been all of them. Let me just look at my notes. Yeah, I think I just named all 8 pathways by which climate change is harming our health, including our mental health.
Now, as you mentioned these 8 pathways, are there certain populations that are more vulnerable to these climate-related impacts? And what would be some examples?
Yeah, great question, Samuel. The reality is that anyone can have their health harmed by climate change, but some of us are much more likely than others. And the people who are most likely to be harmed are our children, our newborns, our children, even children, fetuses in development, pregnant women and their gestating children. The fetuses are particularly sensitive to many of these harmful health outcomes, especially related to air pollution. And then on the other end of the age continuum are older citizens. I don't want to use the word elderly because I'm too close to that cutoff myself, and I don't want you calling me elderly. But older citizens are also more vulnerable. People who are on the lower end of the income spectrum, people who are living in marginalized communities, have less household income, more at risk. Communities of color, more at risk. People who earn their livelihoods by working outdoors, more at risk. And then for some of these pathways of health harm, people like me who like to spend our times outdoors, not because that's where we earn our paycheck, but that's just because we like to recreate. So hiking outdoors, I'm at much greater risk now of Lyme disease than I was when I moved to the area a couple of decades ago, because our climate, our winters are no longer cold enough to be killing off the ticks that are carrying the Lyme disease.
So then how does that impact our lives here in Fairfax County?
Well, so many of these pathways of health harms, the pathways by which climate change is harming our health, they're relevant to us here in Fairfax. Certainly extreme heat events are becoming more common. The vector-borne diseases that we had the Zika outbreak a couple of years ago. That's something we'd never seen before. Hopefully dengue fever will not be coming back to Fairfax County, but it's not out of the realm of possibility to the extent if our ambient climate continues to warm. We're having many more heavy downpours, which means more flooding. More flooding means more wet basements and mold growing in people's homes, which causes health problems. Let's see, just one last one, and that is back to the air quality issue. We really, it doesn't seem like it on a beautiful day like today, but we really do have unhealthful air quality here much of the year. And as time goes on and our colleagues in public health do more research on the deleterious effects of air pollution, we now know this is a really serious problem. Experts that I know make the case that air pollution is the biggest preventable cause of early what they call morbidity and mortality, disease and early death worldwide. For much of my career in public health, we pointed to tobacco as public health enemy number one. But there's a very good case to be made today that air pollution is public health enemy number one. So that is one of the ways in which climate change, which is making air pollution worse, is touching our lives here in Fairfax County.
Now, considering all these impacts, what are actions we can take to help reduce the impact of these climate-related threats to our health in our daily lives here in Fairfax County?
Yeah, Samuel, that's a totally fair question. And I don't know that our listeners today are going to love my answers, but I'm going to give the answers that I believe are true. There are actions that we can take to protect ourselves, but those are actions relatively that work at the margins, if you will. They help a little. So, for example, we can plant shade trees, deciduous trees on our property, so that we lessen the urban heat island effect. That's the warming that happens during the summer as a result of all the pavement and concrete and blacktop roofs that we have. So we can plant green roofs, we can plant deciduous trees, we can do green landscaping around our property, and all of that is very helpful. It will limit the warming on your own property, which will be good for your energy bills, less money spent on air conditioning, but also less health risk associated with it. And I would encourage everybody to think about what they can do at that level. Some of these actions, the green landscaping, also will help more of the extreme rain that falls in a short period of time actually permeate, that's the word I was looking for, permeate through the soil as opposed to flooding our basements. We want to create around our homes, we want as much permeable landscaping as possible to minimize flooding risk. But the really high impact things that we can do, the high impact actions, I'm going to say there are 3 of them. The first one is we can buy clean energy. Okay? Buy clean energy from our utility company. It won't necessarily help our health directly, but it will help everybody's health in our community. Because for every person who buys clean energy or produces their own with solar panels on their roof, or geothermal wells in their backyard, for every person who does that, that's less fossil fuel pollution that we're emitting into the skies, that eventually also comes down into our water supplies. So number 1, buy clean energy. Number 2 would be electrify everything. Everything in your home, everything around your home that can be electrified, electrify it. There's somebody next door right now who's using a gasoline-powered leaf blower. I hope you can't hear it, but I wish she would replace that gasoline-powered leaf blower with a battery-powered leaf blower. And I hope that I will talk to her about this today. And I hope she will charge her battery-powered leaf blower with clean energy, because in doing so, that's really something important that she can contribute that will make our neighborhood as well as our community a safer, better place to live. And then the third and the final thing that everybody can do, pick up the phone, contact your Fairfax County representatives, all of whom are totally on board with the agenda of making Fairfax County a climate smart county, a climate smart community, but let them know how much you appreciate the actions that they're taking, and let them know that you support them taking even more actions. And if you still have time for a second phone call, pick up the phone and call your state representative and let them know how important it is to you that the Commonwealth of Virginia do everything it can to protect our health and our climate, because there's much that can be done, like the Clean Cars Act of 2021 and the Virginia Clean Economy Act of 2020, which were important public health advancements, public health initiatives that will, in fact, make Virginia a safer, healthier place to live.
Now, speaking to these points, with some of your previous work understanding climate change in the American mind, are there certain barriers to perceiving some of these climate risks that you've found within different populations? And also, what are ways that we can help increase our understanding of these climate risks and also help encourage people to make informed action?
Yeah, I encourage everyone to come to as I said before, Google the Medical Society Consortium on Climate and Health, or Google the George Mason University Center for Climate Change Communication. Either way, you'll find lots of information about the health impact, about other impacts of climate change, and most importantly, about actions we can take, solutions that will not only help our climate, but will help our health. And that's a really important point that I want everyone to understand. The actions that are going to be most beneficial for our climate many decades from now also have immediate human health benefits. By cleaning up our fuel supplies, for example, we almost immediately help to clean up our air and our water, which almost immediately allows us to live in better health. It's one of the, we don't tend to think about climate action as a powerful public health solution, when in fact it really is. And to answer your question directly, what are the barriers? Well, I would say the more that we can use public policy to make it easy for all of us to do the right thing. So coming back to my recommendation to buy clean energy, I buy clean energy from a community solar facility in my I would rather have panels on my solar panels on my roof. I can't do that, so I buy from a community solar facility. We can use public policy to make it easier for people to sign up with community solar providers. We can use good public policy to make it easier to put solar panels on their roofs. So the most important thing that we can do is actually adopt smart climate and health policy to make it easy for everybody in this conversation, and everybody in Fairfax County and everybody in Virginia, to do the smart, climate smart, healthy smart action. But the more we make it easy with smart public policy, the more likely people will take those actions.
Now, considering all this work, what are some ways that we can get involved with George Mason's climate change initiatives? Are there any upcoming events that we can take part in?
No, we don't tend to do events so much. We fancy ourselves a think and do tank. So we do a lot of research, and we develop public engagement programs, public education programs. One of those programs is called Climate Matters. We support the TV weathercasters here in the Washington area, as well as in every other media market around the country. We provide them with materials that they can use to educate their viewers about the local impacts of global climate change. So one really helpful thing you could do actually would be call your local TV station and tell them that you want to see them doing more to educate us about the problems associated with climate change in our community and the solutions that we can be moving forward on. So that would be one way to contribute to our programming indirectly. For those of us in this conversation who are health professionals or health workers, I encourage you to join the Virginia Clinicians for Climate Action. That's a group that is not at George Mason University, but they were inspired by the Medical Society Consortium on Climate and Health that I mentioned previously, and they decided they wanted to create a Virginia group of health professionals who were going to work to create climate smart and health smart public policy here in our state capital and in our municipalities around the state. So for anybody who's listening who is a health professional, I strongly encourage you to Google the Virginia Clinicians for Climate Action. They definitely can put you to work and help put that energy and enthusiasm of yours to good use.
Thank you for those recommendations. Now let's see if we can take some questions from our audience members. Looks like we don't have many in today. So on that note, I'd like to say thank you for joining us today with this discussion, Dr. Maibach. This has helped inform me personally and also inform the community about how important climate change is to our health and how relevant it is for us to take action, not only on the local level, but on the broader scale to make an impact and make a difference. So I thank you for your time today. And I also thank the viewers for joining us today as well.
Thanks for having me, Samuel. Let's make every day Climate and Health Day, because the sooner we take these actions, the sooner we will all benefit with better health and greater prosperity.
Absolutely. Absolutely. Thank you again for joining us.
Bye-bye now.